The difference between keeping and losing your foot as a diabetic often comes down to spotting these 5 warning signs early. Hi, I'm Dr. Andrew Schneider, a podiatrist in Houston, Texas, and in my practice, I've helped thousands of diabetic patients prevent serious complications by knowing exactly what to look for. Today, I'll show you what these warning signs are and exactly what to do about them. Before we dive in, I want to make sure you have all the resources you need to protect your feet. I've created a comprehensive guide about diabetic foot care that goes even deeper than what we'll cover today. You can get this guide completely free at www.diabeticfootbook.com. I'll remind you about this again at the end of the video, but I wanted to mention it now because the information inside could literally save your feet. Let me share something that happened to me at the office last week. A patient came in for what he thought was a simple callus. What I discovered nearly cost him his entire foot. The shocking part, he had no idea he was even at risk. This information could literally save someone's foot or even their life, so please take a moment to like this video and hit subscribe. I'll wait. Because what I'm about to share is something every diabetic and their family needs to know. The first warning sign is something that diabetics completely overlook, and it's not what you might expect. It's not pain. In fact, it's the opposite. It's numbness. And here's what makes this particularly dangerous. It's not just simple numbness like when your foot falls asleep. Diabetic neuropathy starts gradually, often beginning with tingling and burning sensations in your toes. Many people dismiss these early symptoms, thinking they're just tired or their shoes are too tight. But here's the critical part. These sensations are actually your nerves crying out for help because they've stopped working altogether. Think of it like a cell phone losing its signal. First you get those warning bars, then calls start dropping, and finally, nothing. Once you lose that signal, in your case sensation, you've lost your body's natural warning system. Without this warning system, you could have a serious injury and never know it. I've seen patients walk on broken bones because they couldn't feel the pain. That's why checking your feet daily becomes absolutely critical when you have diabetes. The second warning sign is even more deceptive. Changes in skin color and temperature. Most people miss this crucial warning sign because they're checking at the wrong time. For those with light skin, you're looking for areas of redness. If you have darker skin, watch for areas that become darker than your usual skin tone. The key that most doctors won't tell you is that you need to check your feet at the same time every day, preferably after you've been sitting for at least 10 minutes. Let me explain why timing matters so much. When you're active, blood flow increases to your feet, which can mask these warning signs. It's like trying to spot a leak in your roof during a rainstorm. You need to check when conditions are consistent to spot the real problem. A change in skin color that lasts more than 30 minutes after removing your shoes is a red flag that immediate attention is required. Now, I need to address one of the most dangerous myths I hear in my office. If there's no pain, there's no problem. This couldn't be further from the truth for diabetics. Remember that neuropathy we talked about? It means you might have a serious injury and feel absolutely no pain. I've seen patients with deep infections who felt fine because their nerve damage masked all the warning signs. This is why visual inspection becomes your new best friend. The third warning sign is what I call the silent destroyer, changes in foot shape. When I mention this to patients, they often think I'm talking about normal aging. But diabetes can actually change the architecture of your foot, and these changes can happen surprisingly quickly. Watch for your toes starting to curl or claw. This isn't normal aging. It's called hammer toe deformity, and it's often one of the most visible signs that diabetes is affecting your foot structure. Pay attention to your arch height too. If one foot starts to look flatter than the other, that's a serious warning sign. These changes create new pressure points in your feet, and when combined with numbness, these pressure points can lead to dangerous ulcers. Think of it like wearing a shoe with a pebble inside, except you can't feel the pebble, and it's actually your own bone creating the pressure. Here's another dangerous myth I need to address. Many people think they can treat diabetic foot problems at home like any other foot problem. This is absolutely false and potentially dangerous. Those over-the-counter corn removers and callus treatments that you see at the pharmacy, they can create chemical burns that your numb feet won't even feel until it's too late. Even something as simple as soaking your feet in hot water can be dangerous because you might not feel the water is too hot. The fourth warning sign is non-healing wounds. But here's what most people don't realize. A wound isn't always obvious. You might think you're looking for a big cut or sore, but in reality, even a small crack in your heel or a tiny blister from new shoes can become a serious problem. Diabetes affects your circulation, and without good blood flow, these minor injuries can't heal properly. What might heal in a few days for someone else could take weeks or months for a diabetic, and that's time you don't have when it comes to preventing complications. Let me share something crucial about wound healing in diabetics. Your body's healing process is like a construction crew repairing a road. It needs three things: good materials, a healthy blood supply, clear access to the site, good circulation, and proper coordination, healthy nerves. Diabetes can interfere with all of these symptoms at once. That's why even a small nick from nail clippers can become a serious problem if not monitored quickly. The fifth warning sign is infection, but not the obvious kind you might expect. Most people think infections always come with redness and swelling and pain. But remember, with diabetic neuropathy, you might not feel these typical symptoms. Instead, look for subtle signs like unexplained warmth in one area of your foot, slight swelling that comes and goes, or drainage in your socks that you can't explain. Even a mild fever can be related to a foot infection that you can't feel. Now let me share my comprehensive daily foot care routine. Every evening before you go to bed, take 1 minute to check your feet thoroughly. Use your hands to feel for any warm spots. If one foot feels warmer than the other, that's a red flag. Look between every toe and don't skip the bottoms of your feet. Use a mirror if you need to, or ask a family member for help. Pay special attention to any area that looks different from the day before. Throughout the day, take advantage of any time you change your socks to do a quick check. Look for any unusual marks or pressure points from your shoes, and in the evenings, wash your feet with warm water, never hot, and dry them completely, especially between your toes. Apply moisturizer everywhere except between your toes, as excess moisture there can lead to fungal infections. When it comes to shoes, there are some critical things you need to know. Always shop for shoes late in the day when your feet are slightly swollen. This ensures you're getting the right fit when your feet are at their largest. Make sure you can wiggle all your toes freely in the shoes and avoid anything with seams that might rub against your feet. Never wear new shoes for more than an hour at first, and always check your feet after wearing them to make sure they haven't caused any pressure points. If you found this information helpful, you'll want to get your hands on my free diabetic foot care guide. It covers everything we discussed today, plus detailed prevention strategies I use with my patients. Just visit www.diabeticfootbook.com to get your copy. The link is also in the description below. Remember, with diabetes, catching problems early isn't just about saving your feet, it's about maintaining your independence and your quality of life. Early intervention can mean the difference between a simple treatment and major surgery. Before you go, take a moment to subscribe to our channel and hit that notification bell. I post new videos every week with crucial information about protecting your foot health. Also, share this video with anyone you know who has diabetes. You might just help save their feet. Thanks so much for watching, and have a great day.